Good evening, viewers. We welcome to the Arise interview, and we begin today with millions of Europeans who are facing stricter holiday travel restrictions as governments across Europe introduce more curbs to fight a surge in COVID-19 infections. Since it emerged in late November, Omicron has been detected in at least 38 of the 53 countries in the European region, and it is already dominant in several of them. Germany and Portugal are among nations announcing post-Christmas curbs and greater social distancing measures. In the United Kingdom, Prime Minister Boris Johnson has ruled out any new restrictions for England before Christmas, but Scotland, Wales and Northern Ireland have all announced curbs on social mixing. The World Health Organization has warned countries to brace for a significant surge in cases, and it has advised the widespread use of boosters for protection.
We can see another storm coming. Omicron is becoming, or already has become, dominant in several countries, including Denmark, Portugal and the United Kingdom, where its numbers are doubling every 1.5 to 3 days, generating previously unseen transmission rates. Within weeks, Omicron will dominate in more countries of the region, with a threat to push already overwhelmed health systems further to the brink. The sheer volume of new COVID-19 infections could lead to more hospitalization and to disruption of other critical health services.
Well, for more on the COVID surge around Europe, fueled by the Omicron variant, let's cross live now to London to speak to Professor Deenan Pillay, who is a scientist and a professor of virology at the University College of London. He is also a member of the independent SAGE, which is a group of scientists who provide independent scientific advice to the UK government and the UK public on how to minimize deaths and support Britain's recovery from the COVID-19 crisis. Prof, welcome to the Arise interview.
Viewers.
Thank you. Prof, was this surge envisaged? Because everyone was thinking by the middle of this year that we had probably seen the worst of COVID infections, and now here we have this new great surge all across Europe. Was it really envisaged by scientists like you?
Well, we know that all viruses will always mutate, and variants will emerge, and there's no difference with COVID-19, unfortunately, and we must expect this in future as well. Having said that, it is really a pandemic. It's affected the whole world, and those areas of the world fortunate enough to have access to vaccines, such as the UK, these vaccines have made a very important contribution to minimizing illness and disease. And even though Omicron is circulating very widely, as you've said, it is very, very infectious, doubling time of within 2 days, less than 2 days. But hospitalizations remain far lower than, for instance, a year ago when Omicron was circulating without the vaccines. So it is very difficult to disentangle at this stage precisely what the manifestations of this Omicron will be for mortality. But having said that, what we're witnessing in the UK is even a little bit of extra stress on the NHS actually is leading to major problems. And of course, in the NHS, many staff are having to isolate and not be working because they themselves either have got COVID, or they're in contacts or family members who had COVID. So the implications are very severe at the moment, certainly in the UK and as you've reported across Europe.
But Prof, is it likely to get worse before the winter is over, or could it get better?
Well, you're asking really very profound questions, which we don't know the answer to. At this moment in time, infections are continuing to increase in the UK, but not increasing as at the rate that we saw initially. We also have all eyes on South Africa because, as you say, that was the country, the scientists there were the first to report this Omicron variant. Wherever it started, it was reported from South Africa. And there's been a tremendous increase in cases, but it looks like over the last few days that the number of cases are starting to decline. And this, of course, gives some understanding that this may also be replicated around the world. But there's a lot unknown. We've got to remember that we're less than a month into the first description of this particular variant, and therefore there's a lot unknown about it. But those countries, I say, that are privileged enough to have access to vaccines for their population, I think will in the main be protected from the disease associated with this.
Thank you, Prof. My last question, since you are the Scientific Advisory Group on Emergencies, what is your advice to the UK and other European governments going forward? How to tackle
Oh, well, thank you for the question. So I chair a group called Independent SAGE, and we're outside of government, and we are a group of experts across the disciplines that want to provide information to the public, because of course everyone is affected in some way by the pandemic. As you reported, Prime Minister Boris Johnson has declined to bring in more stringent measures before Christmas in order to reduce the spread of this virus. By contrast, other countries within the United Kingdom, Scotland, Wales, as you mentioned, have all brought in those more stringent criteria. So in the absence of that, we still are focused on giving advice that, as we know for this variant as well as other variants, the biggest risk is being indoors with poor ventilation with other people. And that is the environment in which we've got to be very careful in. So we recently produced some guidance about Christmas and New Year, which is typically, as for around the world, a time when people get together, families get together. And I think we've all got to be aware that we've got to be making sure that we don't have symptoms, making sure if you have access to testing, to making sure that people are test negative before meeting each other, ensuring that ventilation is as good as it can be, even though it's the cold weather here in the Northern Hemisphere. And of course, where vaccines are available, making sure people are fully vaccinated, if at all possible. So trying our utmost to minimize the risk of transmission.
Professor, we thank you very much for your insight into this matter, and we wish you the best of luck. Thank you very much.